The fourth month marks a turning point in pregnancy. The mother begins to feel better, morning sickness often fades, and the baby grows rapidly inside the womb. This phase brings emotional balance, visible physical changes, and exciting milestones in fetal development. Let's explore in detail the biological, emotional, and physical transformations during the fourth month of pregnancy. Introduction: a new beginning in the second trimester. By the time a woman reaches the fourth month of pregnancy, weeks 13 to 16, she officially enters the second trimester, often referred to as the most comfortable and enjoyable phase of pregnancy. The risks of miscarriage decrease significantly, and many early pregnancy symptoms such as nausea, vomiting, and fatigue begin to subside. This month marks a period of renewed energy, visible physical growth, and emotional adaptation. The baby's body is rapidly forming, facial features become more distinct, and movement begins even if the mother doesn't yet feel it clearly. Let's dive into the details of what happens during this important month. 1. What happens inside the mother's body? The mother's body continues to undergo massive physiological changes to support the growing fetus. 1.1. The expanding uterus. By the fourth month, the uterus expands upward from the pelvic cavity and can now be felt just below the navel. This expansion may cause mild stretching sensations or cramps as the ligaments adjust. The fundus, top of the uterus, rises about 4 inches above the pubic bone. The abdomen starts to show a noticeable baby bump. Some women feel tightness or mild discomfort as the round ligaments stretch. 1.2. Increased blood volume and circulation. Blood volume increases by nearly 40–50% to deliver oxygen and nutrients to the baby. This can cause a rosy glow, often called the pregnancy glow, due to increased circulation. However, it may also lead to nasal congestion, mild swelling, or visible veins. 1.3. Digestive system changes. Hormonal changes slow digestion, leading to constipation, due to progesterone relaxing the intestinal muscles. Heartburn from acid reflux, as the uterus pushes upward on the stomach. A return of appetite, as morning sickness typically decreases. 1.4. Breasts and skin. The breasts continue to enlarge as milk glands develop. You may notice darkening areolas and small bumps, Montgomery glands. Stretch marks beginning to appear on the abdomen, hips, or breasts. Skin changes such as linea nigra, a dark line running from the navel downward. 1.5. Weight gain and energy. Most women begin to gain noticeable weight, about 0.5 to 1 kg per week, depending on their pre-pregnancy BMI. Increased energy often replaces early exhaustion, allowing expectant mothers to return to regular routines with renewed enthusiasm. 2. Baby's development week by week. Inside the womb, the fetus experiences a period of extraordinary growth. During the fourth month, the baby becomes more human-like, and vital organs start functioning. Week 13. The baby measures about 7.5 cm long and weighs around 25 grams. Facial muscles begin to move. The baby may make sucking motions. The vocal cords and bones start to form. The intestines move from the umbilical cord into the abdomen. The placenta is fully developed and begins hormone production. Week 14. The baby is now about 9 cm long and weighs around 40–45 grams. Fine lanugo hair starts covering the body for warmth. Facial expressions form, frowning, squinting, or grimacing. The liver begins to produce bile, and the spleen helps in red blood cell formation. The baby can move its hands and feet, though it may not yet be felt by the mother. Week 15. The baby's length increases to 10–12 cm, weighing 60–80 grams. Bones harden, and taste buds begin to develop. The ears move into their final position on the sides of the head. The baby can sense light through the uterine wall. The genitals develop distinctly, and gender can sometimes be seen on an ultrasound. Week 16. The fetus measures about 11–13 cm and weighs around 100 grams. Facial muscles are active. The baby may even suck its thumb. The nervous system becomes more coordinated. The baby starts to practice breathing movements with amniotic fluid. Heartbeat is strong enough to be heard with a Doppler device. By the end of this month, your baby looks more like a miniature newborn, fully formed but tiny, curled up comfortably in the uterus. 3. Hormonal and physical changes. 3.1 Hormones in action. During the 4th month, the body continues producing key hormones. Progesterone keeps the uterus relaxed, preventing premature contractions. Estrogen supports breast tissue growth and improves blood flow to the uterus. Relaxin softens ligaments and joints, preparing the pelvis for childbirth. Human placental lactogen, HPL, helps prepare the mother's metabolism to nourish the baby. These hormones stabilize after fluctuating wildly in early pregnancy, which is why many mothers feel more emotionally balanced during this month. 3.2 Physical symptoms. Visible bump begins to appear. Less nausea, but occasional acidity or bloating. Increased appetite and occasional food cravings. Dizziness or lightheadedness due to blood pressure changes. Mild backache as posture adjusts to the growing belly. 4 Nutrition and healthcare tips. 4.1 Balanced diet. Proper nutrition is crucial as the baby grows rapidly. A healthy diet includes protein, essential for fetal tissue growth. Sources: eggs, lean meat, chicken, lentils, beans, tofu, fish, low mercury. Iron prevents anemia and supports increased blood volume. Sources: spinach, red meat, dried fruits, whole grains, and iron supplements if prescribed. Calcium helps build strong bones and teeth in the baby. Sources: milk, cheese, yogurt, almonds, broccoli. Folic acid continues to prevent neural tube defects. Sources: green leafy vegetables, beans, fortified cereals. Omega-3 fatty acids supports brain and eye development. Sources: salmon, walnuts, flax seeds, chia seeds. Hydration: drink at least 8-10 glasses of water daily to prevent dehydration and constipation. 4.2 Foods to avoid. Unpasteurized dairy products or raw eggs. High mercury fish, swordfish, mackerel. Undercooked meat. Excess caffeine, limit to 200 mg/day. Alcohol and smoking, strictly prohibited. 4.3 Supplements. Continue prenatal vitamins as prescribed, especially iron, calcium, and folic acid. Never self-medicate. 5. Emotional and psychological changes. The 4th month often brings emotional stability compared to earlier months. 5.1 Emotional balance. As hormones stabilize, mood swings tend to lessen. Women report feeling happier and calmer, more connected to their pregnancy, excited about the growing bump and upcoming motherhood. 5.2 Bonding with the baby. Even though you can't yet feel distinct movements, you may begin talking to your baby or thinking of names. The emotional connection deepens. 5. 3 Common emotional concerns. Some women may still experience anxiety about baby's health and development, body image changes, balancing work and motherhood. Talking openly with partners, family, or healthcare professionals helps manage these feelings. 6 Doctor visits and medical checkups. Regular prenatal checkups are essential during the 4th month. 6.1 Common tests. Weight and blood pressure monitoring. Urine test to check for infections or protein levels. Fetal heartbeat detection with a Doppler device. Quadruple or triple marker test, done between 15-18 weeks, screens for chromosomal abnormalities like Down syndrome. Ultrasound, if not done earlier, to monitor fetal growth and detect any issues. 6.2 When to call the doctor. Seek medical advice immediately if you notice vaginal bleeding or fluid leakage, severe abdominal pain or cramping, persistent dizziness or fainting, unusual swelling of hands, face, or feet. 7 lifestyle and daily care tips. 7.1 exercise. Gentle exercises help maintain fitness and circulation. Walking, prenatal yoga, or swimming with doctor's approval. Avoid heavy lifting or high-impact workouts. 7.2 sleep. Sleep on your left side to improve blood flow to the baby. Use a pregnancy pillow for support. Maintain a regular sleep schedule. 7.3 clothing. Wear loose, breathable clothes. Supportive maternity bras can ease breast discomfort. 7.4 dental care. Continue brushing and flossing regularly. Hormonal changes can increase gum sensitivity. 8. Precautions and safety measures. 8.1 Avoid stress. Meditation, light reading, music, or nature walks can help maintain emotional calmness. 8.2 Travel caution. Short trips are safe if approved by your doctor. Carry medical records and snacks. Avoid long, uncomfortable journeys. 8.3 Hygiene and health. Maintain personal hygiene to prevent infections. Avoid exposure to harmful chemicals or radiation. Stay up to date on vaccinations as advised by your doctor. 9. Partner's role during the 4th month. A supportive partner can make the pregnancy journey smoother. Partners can attend prenatal checkups together, help with household chores, provide emotional reassurance, encourage healthy eating and relaxation. This involvement strengthens the bond between parents and creates a positive environment for the baby. 10. Looking ahead, the journey beyond the 4th month. As the 4th month concludes, the baby becomes stronger and more active. The mother's belly grows more visible. Energy levels rise, preparing her for the next exciting stages, feeling the first baby kicks in the 5th month and continued emotional connection. This month sets the foundation for a healthy pregnancy journey, balancing physical wellness, nutrition, emotional care, and regular medical supervision. Conclusion: a month of renewal and growth. The 4th month of pregnancy is often remembered as a phase of stability, joy, and anticipation. The mother begins to feel comfortable in her new identity, while the baby thrives inside her with rapid development. It's a time to embrace self-care, nourish the body, and connect with the growing life within. Every heartbeat, every ultrasound image, and every subtle change brings you closer to meeting your baby, the most beautiful reward of this extraordinary journey.